Hi there, my name is Craig Gorgian. I'm an assistant professor in biomedical engineering here at Purdue University. Here today to talk about our work to develop an enhanced imaging system for vibrational photoacoustic tomography that combines ultrasound imaging with pulse laser light. So a little bit of background first. Non-communicable diseases are a major medical need right now. This includes cardiovascular disease, diabetes, and cancer. Global cost of over $30 trillion over the next 20 years. Which is a major impact and leads to a lot of need for medical imaging specifically. So trying to diagnose these diseases that cause 63% of all deaths ahead of time can lead to improved patient care for each of these. So what is photoacoustic imaging? Well, it takes advantage of ultrasound imaging, and then instead of using the ultrasound signal to listen for reverberations back, we use pulse laser light that can be delivered into tissue, create a small increase in temperature that leads to expansion, and that expansion then can be picked up via ultrasound signal from the transducer we have set up here. So fibers coming in with light on the side with an ultrasound transducer in the middle, able to pick up the acoustic wave that's created from the optical signal. And what others have worked on and shown that long wavelength near-infrared light is great for delivering deep into tissue and then exciting specific molecules for vibration and excitation of the signal to produce an ultrasound signal for photoacoustic imaging. So what we found in collaboration with other groups here at Purdue and others have confirmed is that right at 1210 nanometers, we see a peak for lipid imaging. At 1100, we get great signal for blood, and then we can use off-resonance signals as a negative control. So what are we able to do with this? First, we can look at lipid imaging in vivo. We can identify areas where there's increased fat accumulation or where nerves are running underneath the skin. We can look at ablated tissue and cardiac tissue that's been damaged for preventing arrhythmias. Both before and after, you see a large signal in photoacoustic images on the right. And then finally, with tumor biopsies, after resection during lumpectomy, we get to see the margin, or looking at how thick the healthy margin is around the cancerous region to detect positive or negative margins during lumpectomies based on the lipid signal that we can acquire very quickly with a three-dimensional approach. So now that we know that, we're really trying to improve and optimize our image acquisition approach. So the field has been using basically a standard way to tape or glue these fibers onto either side of the ultrasound transducer, deliver the laser light, and then look for the ultrasound signal coming back. In this case, we now have an optimizable photoacoustic holder with bipolar step motors, external linear step motor on the top, and ultrasound transducer holder with the fiber optic bundles on either side. And with that, we can get translational ultrasound step sizes of 20 microns, and these rotational fibers are going to be able to be varied in angle by 0.9 degrees, so very fine control of the position and angle for each of these. And with that, we can then use imaging of a phantom. So here we've created a agarose gel with actually a PVA gel with different PE tubings inside of these, and each of these lets us create the photoacoustic signal at different depths, ranging from 1 to 7 or 8 millimeters into the tissue. And so we can see that in the signal here. When we have a focal length of 2 millimeters, we get great signal in the shallow regions, whereas if we go further down to the deeper signal, we get the tubes that are further into the phantom are able to be visualized in this deeper signal on the right. So that's what it's showing down here as well, that the signal improves in the deeper ones as we increase the focal depth. And that also means that from an in vivo standpoint, we do these in mice that have lipid accumulation in them. We're able to get in vivo signal without any kind of contrast agent or any invasive approach, no ionizing radiation, which allows us to look at subcutaneous and perivascular fat with a 2 millimeter focal depth. That seems to be better here than the deeper 7 millimeter. And you can do this then as SNR, signal to noise ratio analysis for whatever region of interest you're focused on to see then what's the right characterization for both angle and offset that you need for each of your fibers. Quick legal landscape, we've been able to file a provisional patent with the Office of Technology and Commercialization here at Purdue, and there are no third-party obligations. We're excited to work with other imaging companies or people in the area that are interested in this technology.